the phosphodiesterase inhibitors, again, are a whole host of different pills that you can take. So again, the most common one, again, is Viagra. People know the most about that. Of course, Cialis lasts a little bit longer. Also an excellent phosphodiesterase inhibitor, as well as Levitra, and a new one, what's called Stendra. How do all these work? Well, each of these pills, the way that they work is you take a pill and it actually causes, and systemically, it is ideally targeted to a specific, what's called a receptor actually in the penis. So when a man gets an erection, those nerves will release a chemical. That chemical then causes that blood flow and that dilation of the penis. All these pills do is just cause that chemical to stay around a bit longer. And again, it doesn't mean that you're going to have an erection if you take Cialis for 36 hours. It just means that when you get stimulated, it's going to cause you to have a better erection in those next 36 hours. Same thing with Viagra. Give or take, it's about 6 or 8 hours. Some people actually see some residual effects potentially in the next day if they try to have intercourse. So the bottom line on those is that they all have advantages and disadvantages, but they're very, very similar. And you have to have functional nerves to make sure that those nerves release that chemical, and that chemical actually will stick around longer. So that's one thing that routinely we give on most of our patients right after surgery. The second thing is the vacuum erection device. Well, what is it? It's a vacuum, right? And all it is, it's a cylinder that goes over the top of the penis. And what you do is you can either have a manual pump that basically what you're doing is you're pulling that, it takes the air out like a vacuum, right? And it pulls blood flow into the penis. And in the end of the day, all we're trying to do is establish one thing, to pull blood flow in the penis to dilate up that penis. Think about that rubber band that I talked to you about. We want to make sure that rubber band is stretched out, okay? So that we're actually getting a full, the best erection that we can to minimize any scarring. So if I leave that rubber band and I'm never stretching it out, it's going to be much more difficult for me to stretch it out long term. So in the early phases, a vacuum erection device is very helpful. And again, it's not everybody that gets a vacuum erection device, but a lot of our patients do, because we want to make sure that we're actually getting that blood flow in the penis to make sure we're actually, again, hopefully getting the best erections possible as time goes on. Okay, the injection therapy. Injection therapy is different, okay? Injection therapy is actually where you have a small little needle, and again, needle and penis, I get it. People are already, their mind is wandering elsewhere. But it's a little bit like, diabetes, is that you're actually putting a needle, but in this particular one, you're putting a needle in the side of the penis. And there's a specific dosage that we recommend for people. You put it in the side of the penis, and then what happens routinely in the first, 3 to 5 minutes, that bypasses all the nerves and everything, and it causes that direct dilation and that direct erection. We have to be careful though. We want to make sure that we're getting a good erection, but if we get an erection that's too good, meaning that it lasts, let's say 100% erection, that's the risk that we have of potentially having an erection that lasts 4 hours or longer. The problem with that, some men will say, well, that sounds fantastic, an erection that lasts 4 hours. Well, it may sound like a good idea right now, but the bottom line is that what happens is if you get blood flow that's stuck in the penis for 4 hours or longer, then what happens is that can be a challenge, because you end up causing, potential, damage, and you want to make sure that you're not actually, that blood flow will go out because it causes potential scarring in there. At the end of the day, most guys will do fantastic with this. We start off in a smaller dosage, we inject that, basically we get the right erections, and then those men can actually use that to get the erections that they need to until those nerves actually start functioning again. Some guys actually, when we do, whether it's surgery or whatever it's going to be, radiation, cryo, they're actually not getting good erections, and they never realize that there were options for them that we can actually get their erections back. And for those men, routinely we consider doing injection therapy right off the bat. So they're able to get great erections, however we decide to actually treat their prostate cancer. And then finally, there is the penile prosthesis, also known as the inflatable pump. Now, this should not be confused with the vacuum erection device. The penile prosthesis is also known as the penile pump, is a different one. It's not a vacuum erection device, okay? It's in a surgery where we actually insert the pump, which actually goes in the scrotum, as well as 2 cylinders inside the penis. So when that man actually wants to get an erection, there's a small little pump inside the scrotum that nobody can see and nobody knows. You could walk in the sauna, nobody knows you got this thing, and you push on this, and as you push it, what happens is the erection gets bigger and bigger until you're ready to have the best erection that you can, and then when you're done, you basically just have a small little part of that penile pump, and then basically you just deflate it, and then it just goes back down to, basically to normal levels. So it's not like you're walking around with an erection, 24/7. And that's an inflatable penile prosthesis. Routinely, that's a last-ditch effort, and that's one of the things that we use for men that have not responded to any of the other options that we have in order to get those erections back. Another one that we actually will use, and we don't use it as much now, and a lot of this has to do with the cost associated with this, just because from an insurance-wise, is what's called Muse, okay? And Muse is a small little pellet. It's a dissolvable pellet that actually goes inside the penis, and basically it dissolves in the penis and actually causes an erection, okay? Now, Muse, it's a urethral suppository. It's a meatal urethral suppository, and that's obviously the definition of Muse. M-U-S-E is what it is. It's very good, and we try to use that sometimes on patients for getting those blood flow back on the erections. Unfortunately, we don't use it all the time now because it's significantly cost prohibitive, but hopefully we can get that back on track. And again, it's another mechanism that we can use. So let's go again. So let's go work all the way up the chain. We've got pills that we can use, Viagra, Cialis, Levitra, Stendra. And what those do is they actually help increase that blood flow to the penis. Very easy to use, and we get that back on track. Second thing is the vacuum erection device. It's a small tube that goes over the penis. It pulls blood flow into the penis. And again, what we're trying to do is minimize that scarring around the penis. Third thing, again, is injection therapy. Small little needle goes in the side of the penis. You get a direct erection related associated with that. We just want to make sure we get the right dosage so you don't get an erection that lasts too long. Muse, the meatal urethral suppository. That's a small little pellet. It goes into the urine channel. It dissolves in there within a couple of minutes, and it causes a direct blood flow to the penis itself, and it helps out with erections. And then finally, if all of those things fail, we talk about potentially the penile prosthesis. And again, that's the surgery where we actually put the cylinders directly in the penis. You have another small little device that actually it's inside the scrotum too. Nobody knows that you have it. It's not like you're walking around with this thing hanging out, outside the scrotum or anything. And basically what you do is when you're ready to have an erection, you just pump this thing up, the erection goes up, and when you're done, you basically deflate it, and then you're good to go.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.